Communication is much more than just exchanging words. It's the art of transmitting information and creating meaningful interactions between people. For pharmacists, communication is at the heart of every patient interaction, whether it's sharing important medication information, listening to concerns, or building trust. The process involves not only what we say, but also how we say it, through our tone, body language, and even our appearance. Effective communication is a two-way street, requiring both the sender and receiver to engage, provide feedback, and ensure the message is truly understood. In pharmacy practice, this skill is essential for delivering quality care and achieving positive health outcomes. Communication happens at many levels: interpersonal when we talk to ourselves, interpersonal when we interact with others, and mass communication when we address larger groups. For pharmacists, understanding these levels helps tailor messages to different audiences, whether it's a one-on-one consultation or a public health campaign. There are also various types of communication: verbal, nonverbal, written, and mixed. Each type plays a unique role. For example, nonverbal cues like facial expressions and gestures can reinforce or contradict spoken words, while written communication ensures clarity and record keeping. Mastering these forms allows pharmacists to connect more effectively with patients and colleagues alike. Modern pharmacy, the focus has shifted from simply dispensing medication to providing patient-centered care. This approach requires pharmacists to build trusting relationships, engage in open dialogue, and involve patients in decisions about their treatment. Effective communication is the foundation of this process, helping to ensure that patients understand their therapies, feel comfortable sharing concerns, and are motivated to follow their treatment plan. By listening actively and using clear, simple language, pharmacists can bridge gaps in understanding and support better health outcomes. Patient-centered communication is not just about exchanging information, it's about empowering patients and making them partners in their own care. Perception plays a powerful role in communication. How we interpret messages depends on our own experiences, biases, and expectations. For pharmacists, being aware of these perceptual differences is crucial. Misunderstandings can lead to medication errors or patient dissatisfaction. Communication is a cycle. Our perceptions shape how we send and receive messages, and those messages in turn influence our perception. By recognizing the stages of perception, selection, organization, interpretation, and retention, pharmacists can better understand how patients process information. Using familiar language, checking for understanding, and being sensitive to individual backgrounds helps minimize miscommunication and ensures that the intended message is received. Communication is more than just words. It's also about how we say them and what our body language conveys. Research shows that only a small percentage of a message comes from the actual words used. Tone, facial expressions, gestures, and posture carry much more weight. For pharmacists, mastering both verbal and nonverbal skills is essential. Using clear, simple language ensures patients understand instructions, while positive body language, like eye contact and an open posture, helps build trust. Being mindful of these elements allows pharmacists to communicate more effectively, avoid misunderstandings, and provide the best possible care to their patients.